Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today, we're focusing on the NCLEX content you need to know about casts and tractions, and it's coming out of the Blue Book. So let's go ahead and get started. Hello, Clinic Review families. Dr. Sharon with Clinic Reviews, the home of the very best NCLEX review in the entire universe, in my opinion. Y'all, Mark Klimek started the Clinic Review for NCLEX Review 40 plus years ago, and it's phenomenal. You can get it online on demand. You can also do our small group tutoring. You get a monthly package, and you can join halfway through the month, and the sessions are recorded. And then you can watch any sessions you miss, so you don't have to do it right at the beginning of the month if you don't want to. And then let's see, what else do we have? We have the streaming service. So you can also do that. That does not include the Clinic Review content, the NCLEX Review content, but it includes a lot of videos that you can watch about things that are not in the Clinic Reviews. So today we're talking about casts and tractions. It's pretty straightforward. I'm not going to try to make it more exciting than it is. We're going to focus on what's in the Blue Book, and we're going to just turn these into NCLEX questions. And the reason I do NCLEX questions with you is because you do have to know how to think through questions, y'all. Yes, it's important that you know facts. Okay, it is important that you know facts, but you have to know how to differentiate between different answers, some that seem like they could be right, and then other answers that you're like, I'm pretty sure that's right, but what about this other one? It could be right. And it's this second guessing that gets people. So that's why I want you to hear how I think confidently, how I make clinical judgments, because a good NCLEX question, you're not going to automatically know what the right answer is, okay? You're going to have to think through it clinically. A patient with newly applied long leg cast complains of increasing pain despite receiving prescribed analgesics. What is the nurse's priority action? Priority action. So that means what's best. What's the one thing that I have to do? So let's evaluate this situation. So they've got a cast, they've got increasing pain despite receiving analgesics. So in other words, the pain is not getting any better. Okay. So let's go ahead. Let's think through this. What would we want to do? What would you do if you had a patient who is getting increasing pain in the leg, despite having given them pain medication? Well, I would want to assess it, right? That's what I would be thinking. So the reason I encourage you to think through the question before you look at the answers is because sometimes it can help you not be distracted by the other answers. So let's look at the answers. Notify the healthcare provider immediately. Well, maybe that might be something I'd want to do. Assess the neurovascular status of the affected extremity. Yes, that's what I said I'd want to do. Elevate the leg above heart level. Maybe, but I don't know if that's what I want to do without assessing it. Apply ice packs over the cast to reduce swelling. Maybe, but I don't know that I want to do that unless I know there's swelling. So I don't know there's swelling. So there's not enough information for me to choose C or D. So I'm going to cross those out. So now I have to choose between notify the healthcare provider immediately or assess the neurovascular status of the affected extremity. Remember, this is a best question. And with best questions, you should expect to get it down to 2 and have 2 answers. And you're like, which one is it? Okay. So the way I recommend you assess this or determine it, you say, well, I'm going to notify the healthcare provider, but I'm not going to assess the neurovascular status. Because if it's a priority question, not a first question, but a priority question, what you're saying is, I can only do one thing. So I would notify the healthcare provider, but not assess the neurovascular status. I'm not really okay with it. What am I going to tell the healthcare provider? They're having pain, and I already gave them pain medication. Do you know what the healthcare provider is going to say to me? Well, do they have pulses? Is it swelling? They would ask me all these questions. So, or I would assess the neurovascular status of the affected extremity, but not notify the healthcare provider immediately. And the immediately is the word that it's sort of an extreme word. I'm not saying I'm not saying it's always going to be wrong to notify the healthcare provider immediately, but I don't want to do it immediately if I haven't assessed the leg yet, because I don't know what's going to happen. Maybe they're positioned in a way that's uncomfortable. Maybe they've got some swelling and I need to elevate it, right? There may be things I can do before I notify the healthcare provider. So if I say I'm going to do one, but not do the other, then it's really clear that I need to assess the neurovascular status of the affected extremity. And even if you say to me, well, Sharon, I could have gotten that right without having you talk me through it, That's awesome. I'm glad you could have gotten it right. But there's going to be a question a best question or a priority question that you're not going to be able to get right without doing what I just taught you. So what I'm trying to do is teach you testing strategies so that when you get into a situation where you have it down to 2 and you're not sure which one, and it's a priority question, you don't throw your hands up in the air and go, I don't know, I guess I'll just randomly pick one. There's no randomly picking. You need to have a strategy to use. A nurse is caring for a patient in skeletal traction, which of the following findings requires immediate intervention. Okay, immediate intervention means it's unexpected. If it says which requires you to call the healthcare provider, that means it's an unexpected finding. If it says which requires immediate action, that's the unexpected finding. If it says which one do you have to, which one are you most concerned about, that's the unexpected finding. So skeletal traction. What is skeletal traction? I don't know if I said this, but this is coming out of the Blue Book. You can get the Blue Book at Amazon, or you can get the Blue Book app at clinicreviews.com. It's just called the Blue Book, y'all. It's called the Blue Book. That's the name of it. Clinic Blue Book. It'll pop up for you. Okay. Skeletal traction means it actually goes right into the skeleton. So it's actually screwed into the bone, and it realigns the bone, because a cast realigns the bone, but a cast realigns the bone when you realign the bone without cutting into the skin. So if you have to cut into the skin to realign the bone, that's called open reduction. The word reduction in an orthopedic setting means realignment of the bone. So think orthopedic reduction is realignment of the bone. The R and the R go together. So open reduction means I cut into the skin to realign the bone. Closed reduction means that I don't cut into the bone. I just realign it and put a cast on it, or maybe put some pins in it or something like that, or even realign it maybe some other way. So here we have skeletal traction for realigning the bone and keeping it in place. So what would I expect to be expected versus unexpected? Serous drainage of the pin sites. I always say clear is good, cloudy is bad. Serous is clear, usually yellowish drainage. Sometimes it's just super clear, but sometimes it's a little bit yellow. And I don't mean cloudy. I'm not talking about cloudy yellow. I'm talking about clear yellow. Okay, so clear is good, cloudy is bad. So serous drainage of the pin sites is fine. That's expected. Weights hanging freely off the floor. Skeletal traction. Sometimes skeletal traction does have weights. Well, I guess if it's skeletal traction, it would have weights, and you don't want the weights on the floor, because then it's not applying any weight. So the weights help pull it into place. So that's fine. Redness and swelling around the pin sites. Well, that's not good. That means there's some irritation or maybe some infection. The traction ropes are aligned over the pulleys. So skeletal traction is when you have the pins actually screwed into the bone, and then you have the weights hanging off of those so that it pulls that into proper alignment. And the weights don't just they hang freely off the floor, but they have to go over a pulley mechanism so that it's not just straight pulling. Okay, it's kind of a little bit of an elaborate setup, but they kind of go over a pulley mechanism, like a metal ring kind of a thing that it goes over. So those are aligned. The ropes should be aligned over the pulleys. So that's true. So which requires immediate intervention? Well, serous is expected. Weights hanging freely off the floor is expected. Redness and swelling is unexpected. Traction ropes are aligned on the pulleys. That's expected. So redness and swelling around the pin sites is what I would require immediate intervention. A patient with a cast on the left arm is being discharged. Which statement by the patient indicates a need for further teaching? So just so you know, casting means they had some kind of closed reduction. They realigned the bone without cutting into the skin, and then they had a cast placed on it. I can use a coat hanger to scratch under the cast if it itches. I will keep my arm elevated above heart level. I will report any numbness or tingling on my fingers. I should exercise my fingers to promote circulation. So what is the biggest concern with a cast? Well, the biggest concern with a cast is that you could have some swelling or problems underneath the cast. So what you don't want to happen is for there to be swelling or infection under the cast so that it cuts off the circulation to the hand. So if I use a coat hanger to scratch under the cast if it itches, now don't tell me if you used a coat hanger to scratch under the cast if you had one. I'm telling you what the nurse teaches the patient. The nurse teaches the patient, don't do that, because it could scratch the skin, and there's no way you can get under there to clean it or anything like that because they have the cast on. So we go, no, don't do that. You could cause injury. So that's not right. That would need further teaching. Keep my arm elevated above heart level. I mean, there's nothing wrong with that. It keeps the swelling low. So like anything you want to keep swelling down on, you can elevate it above heart level. That's fine. Report any numbness or tingling. Well, that would mean I'm having some neuro stuff, often from swelling. I should exercise my fingers to promote circulation. Well, yeah, absolutely. Exercise those fingers. No reason not to do that. So the one that needs further teaching is if they say I'm going to use a coat hanger. And that's because I don't want to cause damage or some potential infection on the skin, and then I can't get to it. A patient in skin traction. So skin traction is different from skeletal traction. Skeletal traction is when the pins are actually screwed into the bone, and then the weights hang off of it. But skeletal traction is when there's no pins. It's just like a sling that's put, say, around, it's often on the leg. So a sling around the leg, and then the weights hang off of that the same way, still over a pulley. They hang off the floor, and it pulls that extremity into alignment. Okay, so a patient in skin traction for a fractured femur reports severe pain in the affected leg. The nurse observes that the foot is pale and pulseless. What is the nurse's priority action? Priority action means what do I have to do? If I can only do one thing, what do I have to do? So pale and pulseless. Y'all, that's not good. I have quite a bit of data here. I don't know that I need to do further assessment on this because I have a leg that's not getting circulation. A pulseless leg is an emergency, y'all. Okay, that's an emergency. Reassure the patient that this is expected. Absolutely false. Notify the healthcare provider immediately. Yes. Administer the prescribed analgesics, not for pulselessness, y'all. If it was pain, that would be fine, but not for pulselessness. Reposition the extremity for comfort. It's pulseless. No, absolutely not. I have to notify the healthcare provider immediately. So that's why I wanted to show you how there are times you're going to say notify the healthcare provider over some of the other options. And that's because we know it's pulseless. So one of the big concerns we have when someone has a broken bone is what's called compartment syndrome. Compartment syndrome is where the muscle around that broken bone, the muscle swells up so much that it actually cuts off the circulation. And so here are the 6 symptoms of compartment syndrome, or really any kind of severe, so here are the 6 symptoms of compartment syndrome, where that muscle swells up so much and it can't get circulation because it's compressing the vessels. Pain, pulselessness, pallor, poikilothermia. Okay, that's coolness. That's where the temperature goes down. So poikilothermia. Paralysis. That means they can't move it. And it's not that it's actually paralyzed, it's that it's so swollen they can't move it. And paresthesia, which is numbness and tingling. So can you remember those? Pain, pulselessness, pallor, poikilothermia, which is low temperature, paresthesia, and paralysis. Oh, I always forget that last one. I always have to think about that last one. Okay. So those are all things that require immediate notification to the healthcare provider. Which of the following assessments would indicate to the nurse that a patient with a leg cast is developing compartment syndrome? Okay, there you go. The patient reports pain that increases with limb elevation. Okay, so we have one symptom, pain. The toes are pink and warm with brisk capillary refill. Well, no, because you have impaired circulation with compartment syndrome. So B is out. The patient complains of itching under the cast. No, itching is not one of the P's. The patient cannot dorsiflex the toes. Dorsiflex the toes means bend them. The patient cannot dorsiflex the toes of the affected foot. All right, so the patient reports pain that increases with limb elevation, or the patient cannot dorsiflex the toes of the affected foot. Well, pain is a symptom of compartment syndrome, but I don't know that increases with limb. Actually, I would think with compartment syndrome, the pain would decrease with limb elevation, because compartment syndrome is swelling, and the swelling actually gets worse with dependency, right? So with elevation, that swelling would be reduced, and it would seem like the pain would decrease with limb elevation. If you can't dorsiflex, if you can't bend your toes, that would be because of the swelling. Well, what is compartment syndrome? It's swelling. Okay. So the one here that's most indicative of compartment syndrome, which is swelling. So is D actually. And that did require quite a bit of clinical reasoning, y'all. So I know I taught you the 6 symptoms of compartment syndrome, but you have to still think. So if they had said they report pain and paralysis, I'd have been like, well, those are classic signs of compartment syndrome. But they didn't say that. They said pain that increases with limb elevation. So I say to myself, why are they telling me pain with limb elevation? And what I did was I said, well, keep it on the list. Let me look at the other options. Immediately crossed off B and C. And then I looked at D and I thought, that's interesting. Let me think about that. So what I mean when I say you're going to have to use clinical reasoning to answer NCLEX questions, this is a really good example of using clinical reasoning to answer an NCLEX question. You didn't memorize this. You have to use clinical reasoning. When caring for a patient with a spica cast, which of the following nursing interventions is most important? So you have to know what a spica cast is. A spica cast is any cast that covers part of the trunk. Okay, it has to cover part of the trunk and usually the lower trunk. I mean, it could cover the entire thoracic area and abdomen, but it has to at least cover part of the abdomen. Okay, and what happens is because of the compression on that, it can cause compression on the trunk, can actually decrease circulation to the gut area, which causes a lot of GI symptoms. Okay. So a nurse is caring for a patient with a spica cast, which of the following nursing interventions is most important. So what I say to myself is this covering part of the gut abdomen area, ensuring the cast remains dry. Okay. That would be true. Encouraging ambulation. Yeah, we want to do that. Monitoring for signs of CASTS syndrome. All right. You have to know what CASTS syndrome is. CASTS syndrome is the syndrome that occurs with a spica cast when you have impaired circulation to the gut. That's what CASTS syndrome is. Do you see why you need to know vocabulary and you have to understand what things mean? So yes, I need to monitor for that. Teaching the patient to isometrically exercise. I don't, I'd have to think about what that means. I could probably figure it out, but I can't imagine D is correct. So I have to say what's most important. Is it most important to keep the dry, that I encourage ambulation, or that I monitor for CAST syndrome? So I need to do all of them, but this is specific to a spica cast. And because it's asking me about a spica cast, I know that they're asking me something unique to a spica cast because I don't have to monitor for CAST syndrome in someone who has an arm cast or just a leg cast. But for a spica cast, I do. So I'm going to ask the question I'm going to answer it based on the question that's being asked. And I'm going to make sure I address the concern that it seems to be talking about. And that's why C is the correct answer. Plus C can cause the most harm. And the other two are important, but they don't necessarily cause harm. A patient with a hip fracture is in Buck's traction. Buck's traction is a skin traction. It's a sling to the leg that then is pulled with weights to align. I don't know. Looks like it's a hip fracture. So align the lower extremity. So Buck's traction, skin traction with weights. Which statement indicates that the patient needs further teaching about the traction? The traction will reduce the fracture. The traction will keep me from moving in bed. The traction will relieve muscle spasms, or the traction will help prevent deformities. All right, so what does the word reduce mean? Reduce means realign. Well, Buck's traction does realign. That's what it does. So it will help reduce the fracture. So that's a true statement. So we're looking for further teaching. We're looking for the false statement. So A is true. Traction will keep me from moving in bed. Well, that's not true. Now, you may not move the leg that's in traction much, but you can actually turn onto the unaffected side. You can move a little bit. You can lift yourself up in bed. You can put your head up, right? You can do all kinds of stuff in bed. You can't get out of bed, but you can move around in bed. That's fine. So B is false. The traction will relieve muscle spasms. Actually, that is partly true. That is part of what Buck's traction does. It relieves pain and spasms by having that. That's part of the reason we use it. The traction will help prevent deformities. Well, that's true because if you're waiting for surgery and you don't do that, you don't do the Buck's traction, you could end up having some bone realigning it in a way that's not correct. And so you could have some deformities from that. So actually the one that's untrue is that the traction will keep me from moving in bed. When preparing to remove a patient's cast with an electric cast cutter, the nurse should explain that. Okay, electric cast cutter. The saw will cut through the cast and your skin. Well, I hope not. The cast cutter will feel hot during removal. Maybe. I hope not, but maybe. You will feel a vibration, but it will not cut your skin. Removing the cast will be painless. I can't really assure somebody's going to be painless. I don't know that. That doesn't seem right to me. So I'm going to cross off A and D. So is it more likely the cast cutter will feel hot, which could be quite painful and could burn your skin, or it'll vibrate, but it will not cut the skin? That seems more likely. C seems much more likely. And so just based on common sense alone, because I've never removed a cast using a cast cutter, honestly, I've never in real life seen a cast cutter. I never have. But I'm going to use my common sense. I'm not going to pick the answer that says, yeah, it might hurt, right? No, I'm going to say, no, here's what's going to happen. We've, developed this in a way that it works, but hopefully won't hurt you at all. A patient in traction needs to be repositioned up in bed in traction. So it doesn't say skin or skeletal. So we know that whatever kind of traction is, there's some weights hanging off. What is the appropriate action by the nurse? Use the trapeze bar to assist the patient in repositioning. So that means they use the trapeze bar over top and they adjust themselves using that. What is the most appropriate action? That seems reasonable. Release the traction weights during the repositioning. No, we don't release traction weights. Pull on the trapeze ropes to remove the patient. Pull on the traction ropes. No, I don't mess around with the traction ropes. Remove the traction device temporarily. No, we don't remove it. So we're not going to mess around with it. We're going to let them use the above bed trapeze bar. The trapeze bar is the thing that hangs above them and they can grab a hold of to move themselves around. So that's, and we always put that out. So anyone who's in skeletal or skin traction, we're going to put the trapeze bar on their bed. A nurse is caring for a patient in skeletal traction for a femur fracture. Which of the following observations should be reported to the healthcare provider? So I report unexpected findings. I am most concerned about unexpected findings. I immediately intervene with unexpected findings, and I report unexpected findings to the healthcare provider. Clear serous drainage at the pin sites. Well, that's normal. And remember, skeletal traction is where you have the pins going through the skin and kind of screwing into the bone. So clear serous drainage, that's fine. That's normal. Traction weights are hanging freely. That would be expected. The patient has a elevated temperature. I would not expect that. The patient performs ankle and foot exercises. Yeah, whatever they can move, they can move. They're in skeletal traction, but if they can move their foot, that's fine. It's a hip or femur fracture, so they can move their foot. So the only unexpected finding here is that they've got an elevated temperature. They've got a fever. A patient with a cervical traction for neck fracture is being monitored by the nurse. Which findings should be reported to the healthcare provider? So I don't know how surgical traction works, but it must be skin traction. I can't imagine they do pins into the cervical spine. So we've probably got some kind of traction, probably either pulling the body down or pulling the head up. I'm just thinking through this. Okay, let's see. I would think the traction weights wouldn't be that heavy. Which should be reported to the healthcare provider? The traction weights total 15 pounds is prescribed. Well, if it's prescribed, and 15 pounds seems reasonable. Like I would definitely not want it to be 40 or 50 pounds, but 15 pounds, because there could be like 3 weights, right? Like, or 2, one on each side, maybe pulling up and back. So that seems reasonable. The patient reports difficulty swallowing. That's a problem because our traction is around the neck, right? We don't want to have difficulty swallowing. They're in a supine position with the head aligned. Supine is on your back, so that makes sense. The pin sites show no signs of infection. Oh, it is pin. It's a pin. Oh, okay. It is skeletal traction. All right. Well, then we're going to be pulling it using a pin, and that's fine. There's no signs of infection. That's fine. I'm not going to question the fact that they're using a pin. So we would want them, let's see, which am I most concerned about? They report difficulty swallowing. That's the one that I'm most concerned about. There could be some swelling around in the neck area that could be causing a problem. A nurse is caring for a patient with cast on their arm. Which of the following should the nurse be most concerned about? Always most concerned about the unexpected finding. A patient reports numbness in their fingers. Well, that's concerning. They should not have numbness in their fingers. That's paresthesia. Remember I said the 6 Ps? Paresthesia is numbness in the fingers, so that's a concern. The cast is white and shiny. That's actually what it's supposed to be. When it's dry, it's white and shiny. When it's not dry, when it's still wet, it's gray and dull. D-U-L-L, gray and dull. The patient is elevating their arm on a pillow. That's fine. The cast edges are smooth and padded. That's fine. No problem with that. So I'm concerned that they have numbness in their fingers. Remember, that's paresthesia. It could be, doesn't mean it is, but it could be compartment syndrome, and I don't like that. Okay, that's it. I hope that was helpful to you. I know I didn't talk everything there is to talk about orthopedics, but that wasn't my purpose. It was to talk about CASTS and traction. And that is what you need to know, in my opinion, what you need to know for the NCLEX. So I hope you have a great rest of your day. Thank you for being a part of the Clinic Review family, and good luck on your NCLEX.